My name is Chen. I am a nurse consultant in one of the NHS trusts in the Northwest. And I suppose my task is to talk about work ethics a little bit. But also, I suppose, just a disclaimer, I'm not a director. I don't own a business. I don't intend to own a business. I am happily and gainfully employed in the NHS. I suppose one of the things that has become apparent, I think, as we've run some of these sessions is how probably as a resource, human resource is probably your greatest expense as directors. And I think Sam said, it feels like, of course, a funeral in here. So I suppose my job is to lighten up the mood. But human resource are probably your greatest expense. But what we're seeing is probably a lack of investment in that human resource. And then that causes, I suppose, problems in the long run. So there's something about training and there's something about honest, genuine conversations in the workplace that seems to be maybe lacking or that needs to improve. And so we're seeing a lot of people, I suppose, a lot of organizations being pulled down by the very same people that we gainfully employ, partly because they're not disciplined. They lack discipline. They lack professionalism. They lack the work ethic and the same vision that maybe you yourselves as directors have for your companies. And that's problematic, and certainly something that we're seeing in the NHS. And so why do I come and talk about this? I suppose as an encouragement, I guess, because you spend a lot of time doing recruitment and spend a lot of money recruiting people and putting systems and processes in place only to find yourselves, I suppose, losing those same people or spending a lot of time paying out in terms of sickness or claims being put against you, which is just, I suppose, a pity. I think when we went into a workforce crisis, a lot of companies were set up and a lot of people employed relatives, people from other countries and so on, Zimbabwe included, because that's where I'm from. And they came at the right time, I think, to support services and your organizations and companies, but didn't necessarily have the acumen that maybe is required to work in a UK system. And so you find some issues that shouldn't really be issues occurring. And whilst they may have mandatory training, there's something around having a genuine conversations about what the United Kingdom maybe entails, what a health system here entails, what is expected of people when they work in organizations. Recently, I talked to a woman who had been referred to the police, and so we're seeing unprecedented numbers going through NMC, for example. Our nurses are going through the NMC for very petty cultural differences, I suppose, in terms of systems. And this woman had patted a nice little old lady on the cheek as she was trying to get her up. And a simple pat turned out into an assault charge that went to the police. And there was no criminal offense there. The police said there's no crime to answer. But the NMC definitely had issues with it because this poor old lady's cheeks went red and the family complained profusely. Now, when we had a conversation with her, she said, well, in Zimbabwe, this is what we do. We just, we pat them on the cheeks and we say, darling and sweetheart. The plea is to invest in the conversation. You know, I talk to a lot of people. I have a large contingent of international nurses that I look after. And we talk about basic things like weather. And we find that people have come and have not been told how cold it is. And so they struggle. They really struggle and get depressed and can't survive simple things. And yet it would be far easier as employers for a sit down, for a conversation around the United Kingdom is cold. Come here expecting that it's going to be cold. Come here expecting that if you're going to drive a car, that it should have MOT and insurance and there's no cutting of corners, because if you do cut the corners, we will prosecute you and it will affect your employment and it will have an impact on your business. It's not that hard. It's not that hard. But we need to have conversations, I think, as directors around self-awareness. And I think even to the directors themselves, yourselves, I think having clarity in terms of vision in terms of expectation, and articulating those expectations is something I think that would be really helpful in helping organizations to thrive. So, for example, where I work, and certainly something that I'm trying to do as an entity, is to push work ethics and to have conversations around professionalism and professional boundaries. Sometimes the way we speak, even just the way we converse, you know, I talk to my Nigerian friends, and even when they're saying the loveliest of things, their intonation is such that you think they're shouting. And so it's always a fight. And they're like, oh, but Chen, I was saying hello. And you're like, oh, that hello was too strong. And so people come into conflict because the intonation might be all wrong. And then we complain about racism, and we complain about so many other things that then lead us into tribunals and lead us into difficulty. But we, as directors, yourselves as directors, have not articulated your expectations. You've not articulated what the expectation and what the reality of the situation will be. I think there is space here to start those conversations. And so, above and beyond mandatory training, I think mandatory training is good, but it's not enough. It isn't enough. We're spending way too much time that we should be investing in looking after patients properly, having what I deem silly conversations, but that are costly to yourselves and costly to your businesses, but also costly to patient care. So if we are setting up these organizations and these companies, not just purely as a financial incentive, but if you are setting up these companies as a way to improve outcomes, as a way to improve patient care, as a way to contribute to the general health system, then I think you have a responsibility as directors to have conversations. You have a responsibility to prepare your workforce adequately and sufficiently so that we are fair with one another. Because unfortunately, you know, people are struggling. Your employees are absolutely struggling. And then I think you, in turn, struggle. You know, I was approached recently by someone who said, Chen, can you come and deliver professional boundaries and relationships to my managers? Because they're angry all the time. And I was like, why are the managers angry all the time? And they're angry all the time because they're constantly having complaints made to them by social services. They're constantly having complaints made to them by families. Because the things that we should take seriously, people are not taking seriously. Because in other countries, probably those things don't matter. And so you need to advise us as your employees that in this country, patients are king. Because they are. Patients are important because they are. And so if you are to generate the monies that Sam and Kudze are going to help you manage, then you need to absolutely have the conversation. Self-awareness does not cost much. Telling people to be respectful does not cost much. Telling people to turn up to wherever it is they're working on time does not cost much. Telling people to be kind to one another and sensitive does not cost much. Telling people to observe the law does not cost much. But it's a responsibility that you have. And I think you need to go above and beyond just mandatory training. It needs to go above and beyond just compliance. It needs to go above and beyond just employing and saying you've got a job and you owe me because I brought you to the United Kingdom. I think, you know, you owe us, certainly as a people, to be humane in your recruitment and in your processes and in your thinking. And I think you owe the society and the people that you serve the respect that comes with people being professional, and you owe your businesses, I suppose, the integrity with which you want to set them up. I've not come across a lot of people who, I suppose, do professional boundaries and relationships as a training program. I've not come across a lot of people, but I think they are out there. I think they're out there, and I think it's definitely a conversation to start. And if they're not out there, I think it's something that we definitely from the Health and Social Care Network are thinking about, and something that I talk to Wilson about a lot. And so I guess I come here with that plea, that you look at yourselves, you introspect, I suppose, as organizations, and really think above and beyond the pay that you give people monthly. What else are you giving back? Are we setting people up to fail? Because sometimes, yes, you save us from, I suppose, the poverty of Zimbabwe in over a month, but long term, are you really preparing people for the countries that you brought them to? Or are you preparing people to fail? I had a woman last week whose children were taken away from her because she'd come to work and had a conversation. And in conversations with staff, just general conversation, she likes to talk, she likes to chat, and there's nothing wrong with chatting and talking. But in that chatting and talking, she talked about how her children were watching TV whilst she was at work. And the staff did not tell her that they found anything particularly concerning about this. And she was just describing how happy the children were with this 65-inch television that they'd suddenly acquired. But in that, someone picked up that these children might have been left alone. And so a report was immediately made. And because we are in the NHS and because we're responsible, we had to check. And there's nothing more painful than another African black woman having a conversation with another African black woman, i.e. me, about, did you leave your children at home on their own? Did no one tell you that this is illegal if they are below the age of 12? And realizing that actually no one had told her. And she thought it was okay because this is what she did when she was in Zimbabwe and no one had ever bothered. And yet, for us here, it's difficult. And now she's having to fight for those same children that she comes to work for because no one said, no one advised, no one told her that the systems are different. Simple conversations, but with long-lasting impact. And I suppose when you think about the professional impact of just that, because she's a nurse and because we have referred to social services, NMC will want to know. NMC will be concerned about what sort of an individual she is. Her character comes into question. Her nursing profession comes into question. And actually, if we're not careful, if we do not fight this carefully, she might be deported. All because someone did not say. I will end there, but I think the message is clear. I think the message and the plea is clear. I think you have a responsibility. Above and beyond paying tax, you have a responsibility. Thank you.
Thank you.
I hope there's no questions. I don't know. I hope there's no questions. Oh, are they? Okay.
Yeah.
Okay.
Thanks very much for the valuable information that you have shared with us. But I've got a big problem. I've done research within the last 3 years. I've been a director in our company, talking to people who have recruited some carers from different countries. My findings, I stand to be corrected. 80 to 90% of people who have been recruited, no matter how robust the recruitment policies that Mr. Mshando has given us, which we try to implement, they don't work. They come here to live in the UK, not to come and be carers. They just want to spend the next 3 to 5 years and get their citizenship and then leave. And what has happened in most cases is they work for the first 2 years, and then they hear of these big local companies owned by local people who have got better contracts. The kind of clients they get are very easy. You just go there, make a cup of coffee, and they go out, and they are paid better than us startup companies. And then you find they start resigning, and sometimes they don't even give you any notice. They just tell you, I'm resigning with immediate effect. And you cannot take them anywhere. So these are the problem that most directors here are faced with. No matter how good your recruitment policy is, you go and get those people, they are coming with a mindset They even talk about it when they are still back home in Zimbabwe, Nigeria, wherever, to say, oh, okay, that's fine.